All right, guys, picking up with another video here. On this video, we will be watching, you guys will be watching the lymphatic system, unit 6. This will be lecture number 2 of the unit. Picking up where basically we talked about some of this stuff in the blood lecture, which is the last lecture. There's a lot of overlap between the blood and the lymphatic system, and we'll see that here. So let's just dive in. Okay. Reading through, the lymphatic system consists of a fluid called lymph, vessels called lymphatic vessels that transport that lymph, and then a number of structures and organs containing lymphatic tissue, which is going to contain lymphocytes within a filtering tissue, and then red bone marrow. So right away in that sentence, right at the very first term, lymphatic system, the term lymph is in there. We talk about a fluid called lymph, lymphatic vessels, there's lymphocytes, so on and so on and so on. Okay, lymphocytes, if you think back to our last lecture, were one of our types of white blood cells. Okay, so once again, I just said it, there's a lot of overlap between the blood and the lymphatic system. And we also learned in our last lecture that red bone marrow is where red blood cells, white blood cells, and platelets are made, all those cells that make up our blood. So there is another example of an overlap. The function of the lymphatic system or functions, it assists in circulating body fluids and helps defend against disease-causing agents. So things like viruses, like the coronavirus that we're all dealing with right now. Hopefully none of us are dealing with, but people around the world are. Viruses, bacteria, fungi, so on and so forth. As I said, it's closely associated with the blood, so therefore it's closely associated with the cardiovascular system because it picks up fluid derived from our blood, what we call interstitial fluid, and that's what forms the lymph, which is described as a colorless, watery appearing fluid, and then a group of vessels that actually return it back to the blood. So what that kind of sentence means is that, and we talked about this the other day or in our last lecture, when fluid leaves the blood, it becomes interstitial fluid. And then that fluid can be taken into cells and become intracellular fluid. They can go back out and become intracellular fluid, or interstitial fluid, and then picked up by the blood, becoming blood plasma again. Not always does that fluid return directly back to the blood. Instead, in some cases, it's picked up by the lymphatic system, and thus it becomes lymph. Now, it won't stay as lymph forever because the function of lymph is, one of the functions is just to return that fluid back to the blood, because the lymphatic vessels carry that fluid to a place above our heart on each side, left and right side, and we'll get into that here a bit. And that is where it dumps that lymph back into the blood, and that fluid changes names and becomes blood plasma at that point. Along the way, we have things like lymph nodes that filter that lymph, and that's how it plays a role in protecting us against disease-causing agents. Lymphatic tissue is a specialized form of connective tissue containing large numbers of lymphocytes, which lymphocytes can be described as the major soldiers of our immune system. Very, very important for immunity purposes. Lymphatic system, 3 primary functions. It drains that excess interstitial fluid from the tissue spaces which goes to the blood. Just talked about that. Mentioned carry out immune responses. Cardiac fluid and foreign cells picked up in other locations pass through lymph nodes where immune cells detect any harmful substances or cells. And then third and final function, we'll actually talk a little bit more about this in a future lecture on the digestive system. When we ingest fats, dietary lipids, instead of being picked up by our bloodstream, which is how most of our, when we ingest water or when we ingest glucose, those things are going to be picked up by the bloodstream from our small intestine. But for fats, whatever reason, they get picked up by specialized lymphatic vessels, along with fat-soluble vitamins A, D, E, and K, once absorbed by the GI tract. And we'll get to that, like I said, and we'll talk a little bit more about it here on the next slide or two, but more so here in a few lectures on the digestive system. The lymphatic system supplements and extends the cardiovascular system, but the two systems differ in several ways. Those differences include the fact that lymphatic capillaries are much more porous, meaning they have much more large holes than blood capillaries, which makes them a little bit leakier, meaning stuff can come into them more easily. So they're able to collect fluids, plasma proteins, and blood cells that have escaped the blood. Lymph only moves in one direction, whereas blood moves in two directions. Blood moves away from the heart and back to the heart, whereas lymph is only moving towards the heart, where it's collected, and then back to the point where it returns to the blood, which is close to the heart. Speaking of heart, there is no heart associated with the lymphatic system, so there is no central pumping organ like the cardiovascular system has. So lymph utilizes other means in which to get around. Our skeletal muscles, when they contract, kind of act like a squeezing hand, like thinking like a hand that milks a cow. It helps kind of just push that lymph forward. And the expansion and contraction of our lungs actually changes pressures within our chest that helps draw the lymph up from our abdomen against the force of gravity. So that's pretty cool. There's also some smooth muscle within the walls of our lymphatic vessels that help to push that stuff forward. But really the skeletal muscle pumps and the respiratory pump, as we call it, are some of the more important movements, or moving pumpers, I guess. As I mentioned, when lymph is pushed into the bloodstream, it no longer is lymph. We just can describe that as being eliminated. Although elimination, you might think means that's removed from the body. That's not the case here. And then the flow of lymph is really slow compared to the blood that pumps out of our heart. About 5 liters of blood is moved a minute at rest. That's something that can go tremendously during like maximal exercise. Whereas lymph, we're talking 3 liters in the entire day. Okay, so at the bottom of the page here are many different organs that are labeled. Typically, we use the color green to denote the lymphatic system, whereas like red and blue, purple a little bit, are denoted for the cardiovascular system. Many of those are the different lymphatic organs, which we can classify or categorize, I'm trying to combine those words, into 2 categories, primary and secondaries. The primaries are where cells that are undeveloped, what we call stem cells, divide and then become immunocompetent, a term that means that they just have the ability to mount an immune response. Basically, that just means they become mature immune-fighting cells, and this includes the red bone marrow that we've been talking about here lately, and back at the beginning of the semester in places like in the ends of our long bone, like the femur here, where our blood cells are produced. And then an organ that we talked about a few lectures back in the endocrine system, the thymus. And those are where those lymphocytes become mature, kind of like soldiers. As I mentioned, they're the soldiers of the body. Then the secondary lymphatic organs are where those immune responses take place, where they go to battle. Places like our lymph nodes, the spleen, lymphatic nodules, which includes the tonsils, these things called aggregated lymphatic follicles or Peyer's patches, which is what I usually typically call them, and so on and so forth. This illustration is a figure from your textbook. A lot of things are labeled here. We can see many of the tonsils, palatines, the submandibular nodes, cervical nodes, lymphatic duct, on the right side, left lymphatic duct or thoracic duct, cisterniculi. These are things that we'll get into during the lecture. There's some things in this picture that I like, some things that are kind of missing or not the best illustrated. So I have a similar illustration in a couple slides that I'll kind of point some things out on. If I could, I would, love to combine the pictures because there's things in both of them I like. There's things about them that I, kind of feel like are missing. In fact, one thing I'll, point out is this little tiny pigtail organ hanging off of the large intestine. We call it the appendix. Whatever, I guess they have it labeled, but they don't have it bolded. I guess it's the other picture that doesn't have it labeled, but it's actually a little bit more visible in that one. So anyway, I wanted to point some stuff out in this picture. We'll be talking about a good portion of those things that are, bolded already for you. Let's first talk about lymphatic vessels, or just lymphatics, a system of vessels very similar to our blood vessels, which we haven't really talked much about yet, but we will. The big difference is that, and I mentioned this already, flow only occurs in one direction, towards the heart, although they do typically follow a route similar as what we see with arteries and veins, but we don't have lymphatic vessels in our central nervous system, so in our brain or spinal cord, our bone marrow, our teeth, and any avascular tissue, although the word avascular got cut off there. Now, what I'm going to do is talk about the different types, starting with the smallest and working up to the largest. Our smallest, just like our blood capillaries, are lymphatic capillaries, microscopic in size, and they're closely intertwined with our blood capillaries. They have a unique one-way structure permitting interstitial fluid to flow into them, but not out. So they come in, the fluid comes in, and then that fluid's never going to go back out that same hole. And that's because of its structure, which is illustrated right here in this picture. Now, typically, I use my hands to kind of illustrate this. So you can look up in the top left corner, you can kind of see me still. Hopefully you can see my hands okay. The way that, our blood capillaries are formed is by, if I pretend that, each hand is a cell that forms the wall. The cells are, butted up against one another, and they form what we call tight junctions, meaning that they're fluid tight. Okay? The way that lymphatic capillaries are, the cells overlap one another, and we can see that, here in our picture. Okay? And they aren't fluid tight; they can actually separate from one another. Okay? Connected to each of those cells is what's called an anchoring filament that projects outward into the interstitial space where that interstitial fluid is located, okay, away from the lumen where the collecting lymph will be, or the collecting interstitial fluid will become lymph. Okay, so let me read through. Lymphatic capillaries have loosely overlapping endothelial cells. Blood capillaries have tightly joining endothelial cells. Once again, blood cells, or blood vessel cells, capillary cells, lymphatic capillary cell. Okay. Attached to those lymphatic capillaries are anchoring filaments, which contain elastic fibers and extend out from the lymphatic capillary, attaching the lymphatic endothelial cells to surrounding tissue. When fluid pressure increases in the surrounding regions, those overlapping endothelial cells separate, which allows the fluid to enter the lymphatic capillary. So what happens? Pressure builds up here. Basically, it's like pulling a string. The cells pull apart, fluid comes in. Okay. The anchoring filaments prevent the endothelial cells from collapsing, keeping the spaces between the cells open. When fluid pressure inside the lymphatic capillary exceeds the pressure, the spaces between the endothelial cells close, holding the fluids in the capillary. So once the pressure builds up here, higher than out here, those cells snap back shut, and the fluid will not go back out. So that's how it's a one-way in, not out situation. Okay. Now, specialized lymphatic capillary I want to talk about are called lacteals. Okay, we find these only in specialized structures of our small intestine, what we call finger-like villi. They look like little fingers. And inside of these little finger-like extensions of the small intestine are these lacteals. And this is where our digested fats go. As I mentioned, when we absorb dietary fats, dietary lipids, as well as those A, D, E, and K fat soluble vitamins, instead of going into the blood, they go directly into these lacteals. Eventually, since the lymph returns to the blood, the fat will end up there, but it's just kind of an indirect route. And presence of lipids in the lymph that drains our small intestine appears creamy white, which we give a special name to that lymph. It's called chyle, with a CH, not a K. And from our lymphatic capillaries, lymph will flow into collecting vessels. And these are formed from multiple emerging lymphatic capillaries. They often travel alongside veins and arteries and empty into lymph nodes. They contain valves to prevent backflow and are similarly structured to veins because they have three tunics or three layers. Now, we haven't talked about the structure of veins yet. We will in a future lecture. But veins, they have valves. They also have three layers to their wall, and so do collecting vessels. From the collecting vessels, lymph will flow into lymphatic trunks, which occur with the convergence of multiple collecting vessels from a major portion of the body. There's 9 total. Their names indicate the parts of the body that they drain and their locations. Sorry. There's two jugulars up in our neck, draining lymph from above in our head and from our neck. Subclavians are going to be up, kind of in our upper chest, shoulder area, draining lymph coming from our upper limbs, so our arms. There's a left and right bronchiomediastinal, draining lymph from the thoracic wall, lungs, and heart. There's a singular intestinal trunk, draining lymph from our stomach, intestines, pancreas, spleen, and parts of the liver. And then two lumbars down by our lower back, draining lymph from our lower limbs, the walls and viscera of the pelvis, kidneys, adrenal glands, and the abdominal walls. And I don't have an illustration to show them on this page, nor do I have them on that next page. I was flipping that way, but we can see some of those here on this page. But I'm not really going to even worry about you knowing those. But I am going to have you identify these, what we call collecting or lymphatic ducts. These are the largest of the lymphatic vessels, collecting lymph from those lymphatic trunks. There were 9 of these. There's only 2 of these. Okay? These are the ones that dump the lymph back into our cardiovascular system in 2 places. Okay, right above our heart on the right and left sides. And they meet at a vein in our neck, both on the left and right sides. And there's a valve that's located right there that prevents blood from entering lymphatic vessels or back into these lymphatic ducts. Okay. This illustration shows their location where they dump that lymph back into our bloodstream. Okay. This illustration is showing you your upper chest. Right here would be where your heart is. Okay. And they meet right in the middle of the union of the left and right internal jugular veins, which are 2 big veins in our neck coming down from our head, and then these subclavian veins. Right where those 2 meet on both sides is where that lymph returns to the bloodstream. There will be a valve here, there will be a valve here, what will prevent anything from going from the blood back into the lymphatic system. Okay, these 2 ducts are called the right lymphatic duct and the thoracic or left lymphatic duct. Okay, of the 2, the right lymphatic duct is much smaller. It's only about a ½ inch in length. Okay, what we see right here, that's it. That's all it is from, where the cursor is showing you. Okay, from this point to this point, that's all it is. Okay, and it only drains lymph from this portion of our body in this illustration. That's why I have this picture here. Okay, half of our head, the right side of our head, the right side of our chest, down into a little bit of our abdomen, and then our right arm. Okay, which is what we could say maybe about 30% or so of us, maybe not even that much. Okay, maybe 20%. Okay, that means there's one major lymphatic duct that returns most of our lymph, and that's the thoracic or left lymphatic duct, which is actually a lot longer, 15 to 18 inches in length. If I go back to this illustration, I'll show you where it starts. Okay, right about where our belly button is, a couple inches above that, is a fattened structure called the cisterna chyli that I pointed out on the previous page. And that's the beginning of that thoracic duct, which travels upward, disappears behind the heart, and then we can see it loop around, and there's where it's dumping into our cardiovascular system. Okay. It is the major, and I would highlight this if I were you. Okay, it is the main duct for the return of lymph to the blood. Okay, beginning of that structure is cisterna chyli, which is a large region, forms from the union of the intestinal trunk and those right and left lumbar trunks, which you can see here in our picture on the previous page. Okay. Thoracic duct drains lymph into the venous blood at the junction of left internal jugular vein and the subclavian veins. Okay. All right, let's talk about lymph and lymph nodes. These are oval-shaped biological filters placed along the path of lymphatic vessels, abundant where lymphatic vessels merge to form trunks both superficially and deep throughout the body, and their function is basically just to act like a filter. Okay. As lymph enters one end of a lymph node, foreign substances are trapped by reticular fibers within the sinuses of the lymph node. We have macrophages here. Remember, those are like Pac-Man, chewing up stuff, digesting them, performing what's called phagocytosis. We've got many lymphocytes that do what they do, responding and performing immune responses. Once that lymph has been filtered, it's able to exit the other side of the lymph node. So its structure affects its function, which is the case for many other and pretty much every other organ of the body. So let's talk about its structure and how it acts as a filter. First of all, surrounding the entire structure is shown here in this picture with the color green, is its capsule. Okay, the capsule is made up of connective tissue. Okay, kind of gives support and strength to the outside of the lymph node, but more importantly, it has projections. That's what these white finger-like extensions shown here are. That's why we've opened it up. These are called trabeculae, okay, or fibrous trabeculae. You'll see them sometimes listed as trabeculae is plural, trabecula, as you can see here, is singular. Okay. What they do is they extend into the center of the lymph node and form compartments. Okay. You can see these compartments. Okay. Think of them like room dividers. Okay. If you think like an office cubicle, okay, these are the dividers that create the cubicles. Okay. Instead of having one big just open room, it's got many, many compartments. Okay. Let's see. Trabeculae provide support and provide a route for blood vessels into the anterior node. Internal to the capsules is a supporting network of reticular fibers and fibroblasts. Okay, and we'll talk about those reticular fibers. Okay, I always tell students, think of those like a spider web. Okay, and I've talked about this back at the beginning of the semester when we first talked about connective tissue. Reticular fibers serve kind of two functions like a spider web. They support the spiders, and the spiders being different types of white blood cells like our T's, our B's, those macrophages. They also help trap foreign particles. You know, like you can think of, sorry, hopefully you can't hear my dog barking. She's going nuts right now. Anyway, they trap stuff like a spider web can. Okay. Now the stuff that's going to get trapped are not, you know, flies and bugs and those kinds of things, but instead they're viruses, they're toxins or bacteria. Okay. That way, those T's, B's cells, those macrophages can go to work. Okay. They're going to be found in what's called the parenchyma, the functioning part of a lymph node. Okay. It's, the functioning part of the lymph node is divided into two major parts: the outer, what we call cortex, okay, and then the inner medulla. Okay. Now the cortex, actually there's two parts of it: an outer cortex where you find B cells. There's an inner cortex with T cells and dendritic cells. Okay. We haven't really talked about, won't talk about dendritic cells, but they have an immune function. And then the medulla is where you find B cells, plasma cells, which produce antibodies, and then macrophages, and which we can see here in these boxes labeled in our picture. Okay. Now, let's talk about the way that lymph flows through a lymph node. Okay. There's a kind of kidney bean shape to a lymph node. It's got a convex side, a concave side that's indented. Okay. On the rounded side, the convex side, are many what we call afferent lymphatic vessels. Afferent lymphatic vessels allow lymph to flow into the node. Okay. Notice each of them we've opened up here will have a valve that prevents the flow from going back out of the node towards and into the afferent lymphatic vessels. So lymph is only going to go in. Now, since we've got these irregular shaped trabeculae creating these compartments, the flow of lymph is going to be very, very slow because it's got to meander. It's got to zigzag on its way through. It can't just go straight through, which gives time for those white blood cells, those macrophages, and so on and so forth to do what they do to, you know, to clean that lymph. Okay. Those passageways that the lymph flow through are called sinuses, a series of irregular channels containing branching reticular fibers, lymphocytes, and macrophages. And from afferent vessels, lymph flows through what we call the subcapsular sinuses first. Subcapsular sinuses are just underneath of the capsule. That's why they're called subcapsular. Okay. From there, the lymph will flow through trabecular sinuses, which extend to the cortex parallel to the trabeculae, and then finally into the medullary sinuses, which are close to the concave surface, to the other side of the node. And On the other side of the node are where we find the efferent lymphatic vessels. So we have afferents, we've got efferents, but notice the number of efferents compared to afferents. There's a lot less of these than there were these, which means that flow can come in rather easily, but it's going to trickle out, okay? Thus creating more of a log jam in here. Traffic jam is good though, because that gives more time for those T's, B's, and macrophages to do what they do. Okay? So there's typically only a couple of efferent lymphatic vessels. They have valves just like the afferents. Okay? They're located at what's called the hilum of our lymph node. Okay? The hilum is just a term that refers to the indented region of an organ. In this case, our lymphatic vessels. We'll see a hilum on many organs here on our next few weeks. Like your lungs have a hilum, just the indented portion of your lungs. Okay? So this is where lymph exits the nodes, and they contain valves to prevent backflow. They receive the lymph from the medullary sinuses. Number of efferent vessels leaving the lymph nodes is fewer than the number of afferent vessels entering the nodes, causing the flow of lymph through a node to be slow, as I mentioned. And a couple pictures over here on the right. This is a zoom in under a microscope 40 times. Really kind of just shows on the outside the capsule, but more importantly, the white streaks here are the trabeculae creating the sinuses. Here's what an actual lymph node looks like looks like the groin, the inguinal region. Not a perfect shape like this. We can definitely see the vessels, the afferents, the efferents over here. Not a perfect kidney bean shape to it, but you get the idea. Pretty cool to see actually the real deal though. Okay. Let's talk a little bit more about those and their locations. About 600 bean-shaped lymph nodes exist in our body, located along the path of our lymphatic vessels, scattered throughout the body, both superficially and deep, usually occurring in groups. And the larger groups typically have special names, which many of those were labeled on that first page, and many of those are labeled here on this page. Okay. First major type I want to talk about are the cervical lymph nodes there in your neck, kind of right alongside that sternocleidomastoid muscle that we talked about earlier in the semester. If you go to the doctor, a lot of times they rub on your neck, not because it feels good, makes you feel nice, but they're trying to see and feel for an enlarged lymph node. What we call adenitis is a kind of an easy way to find out if somebody's got an infection or something like that, because they will kind of balloon up. The submandibular nodes are not labeled here, but they were on that first page. Drain lymph from the floor of our mouth, lymph from our nose. They're found in the floor of our mouth. They drain lymph from the nose, lips, and teeth. Superficial cubitals, also known as supratrochlear, right there in kind of the opening anterior side of your elbow crease. They drain lymph coming from your hands and your forearms. Axillaries, right there in your armpits. Drain lymph coming from our arms and our upper chest. Iliac inguinals. This picture has the inguinals, which was what was actually shown here on this previous page. This picture has them both. Iliacs are just a little bit higher up than the inguinals, which are a little bit more towards like the groin crease. And there's others out there that have special names, but I kind of just picked some of the most prominent ones. You can see some of those that weren't labeled on that picture, labeled here, like the submandibulars. Some of the same ones are still labeled, like the axillaries. They don't have the superficial cubitals, but that's okay. Like I said, this image has some good things. The first image has some good things. They're not perfect. And like I said, this one doesn't have the appendix labeled. Pretty good, thing to forget, and pretty bad thing to forget, I should say, for whatever reason. Sternochyli is nice and visible. Thoracic duct. We'll see the spleen, thymus here in our next couple pages. First, let's talk about the breasts, which breasts themselves are not a lymphatic organ, but they have a pretty significant amount of lymphatic vessels and lymph nodes associated with them. And so I wanted to talk about the correlation between those structures. There's two sets of lymphatic vessels that drain the breast tissue, both mammary glands in females and the surrounding tissue. Now, to say that men don't have these obviously would not be the case. Just because we don't have mammary glands doesn't mean we don't have lymphatic vessels draining our breasts, okay? Because we do have breasts. There are lymphatics that drain the skin over the breast, with the exception of the areola nipple. And then there's lymphatics that drain the underlying substance of the breast as well as the skin of the areola nipple. And now here in our illustration, we're showing where that lymph flows, kind of two major routes. There's a smaller third one, but for the most part, they either drain close to the sternum, which the sternum would be right here, or more towards the armpit. Okay? And we can see there are lymph nodes shown throughout. Okay? As far as lymph from this second set here, more than 85% enters the lymph nodes towards the axillary region, which should be kind of common sense based on the more pronounced number of nodes and vessels compared to over here. About 15% come this way along the edges of the sternum. Okay? One big reason I always want to talk about this is to demonstrate how closely intertwined your lymphatic vessels and your breast tissues are, which unfortunately can be very dangerous, especially in females. Breast cancer, as you guys are all aware, very common, unfortunately, in females. And one of the reasons it's so dangerous is because it's pretty prone to spreading. And that's because, and can be done easily, when a cell breaks free from its original tumor, and it can jump into any of these lymphatic vessels, and then it can jump in the bloodstream because that's where that lymph ends up going. And then you're talking about going any and everywhere in the body where it can then set up shop and start the growth of a new tumor. And then you're fighting a big battle. And that's just, if one cell breaks free, not many, which is, what happens a lot of times. So that it kind of, is unfortunately a situation I don't like to talk about, but, I did want to mention it a little bit. Okay, let's move on from lymph nodes to what we call lymphatic nodules. Now, lymphatic nodules, very different than lymph nodes. Okay, they have an egg shape, so that's one difference. A major difference is they don't have a capsule around them. Nodules don't have a capsule, nodes do. Okay, we find them in a layer of what we call lamina propria, which is a type of connective tissue of mucous membranes of our GI tract. So that would be our gastrointestinal tract, stomach, intestines, so on and so forth. Urinary, obviously what that is. Respiratory, that's your breathing, tract. And then the reproductive tract, we all know what that is as well. Since they're associated with mucous membranes, another term for lymphatic nodules are mucosa-associated lymphoid tissue. So it's lymphoid tissue associated with mucous membranes. Okay? Within a nodule, we are typically going to find lymphocytes, macrophages, just like we've seen in other places like our lymph nodes, protecting against bacteria and other pathogens that may enter in these passages, like when we ingest food, when we breathe in air, or with our urine. Okay? Although for the most part, many of them are small and solitary, there are some that occur in larger aggregations and so have a special name. Pyrus patches, which I pointed out on that first page, these little dots in here, okay? They had them on the first page labeled as aggregated lymphatic follicles, and I usually just call them Pyrus patches, but they're clusters that occur in the mucosa lining the ileum of our small intestine. Your tonsils, which I'll talk a little bit more about on the bottom of the page, occur in the mucosa lining the pharynx, and then our appendix, which are at the beginning of our large intestine. I was kind of want to point out, many people are very aware of this. It's very common for a person to have an appendix removed. Many people have their tonsils removed. In fact, there's probably a lot of people running around without some of their tonsils and an appendix. And they survive just fine. I like to think of these structures just like extra protection, and not the most important organs in the body, but they do serve a role, to some degree. Okay, let's talk tonsils. These are masses of lymphoid tissue located in a protective ring in the back of the mouth. We call this a pharyngeal lymphoid ring. This helps protect against bacteria. Very easy to invade us through our mouth, through our nose, because we're always breathing. We're always, bringing stuff into our mouth by, eating, drinking. Usually we have 5 tonsils total, and that means we've got 2 pairs and a singular one. Okay, the singular one is called an adenoid or pharyngeal tonsil, which we can only see in this left illustration because we've cut part of the roof of the mouth away. Okay, the palate, the roof of our mouth has been removed, so we can see it because it's up kind of more posterior to our nose. If we just open our mouth, we'd never be able to see it because it's back up there. There's that sphenoidal sinus we learned about earlier this semester. So it's pretty far back in there. Okay. The two palatines are on the left and right sides of the back of our mouth. These are the ones that are typically removed when somebody has a tonsillectomy. These are the ones that, when you open your mouth and say, ah, when you go to the doctor, this is what they're looking at. And they can be a nuisance, coming, really big and cutting off that, what we call fauces, the opening into our throat from our mouth. And then the linguals, anytime you see the word lingual, I've mentioned this before, it refers to the tongue. These are located at the base of the tongue, and there are two of those as well. Okay. Sometimes these are removed along with the palatines when a person has a tonsillectomy. There's also what's called an adenoidectomy when they remove that pharyngeal or adenoid, as it's also known as. Okay. This left image shows you those tonsils, kind of nice straight on view. This shows you a little bit more where they're kind of truly located. This illustration, actually, I snagged it from a future chapter, and what I did was I just drew in with arrows. Obviously, you can see the three different sets of tonsils here. We'll see the same illustration when we talk about the respiratory system, where you're going to see a lot more things labeled, stuff within the nose, the mouth, the throat, so on and so forth. So you'll have that to look forward to here in a future lecture. Okay, let's talk thymus, an organ we've discussed fairly recently. Sits on top of our heart. It's bilobed, surrounded by a capsule, and it's structured a lot like our lymph nodes in that it has that capsule on the outside, but then it's got the finger-like extensions penetrating inward that help separate those lobes, the two lobes, into further smaller structures called lobules. And those extensions of the capsule called trabeculae, just like they were with our lymph nodes. Each thymic lobule consists of a deeply staining outer cortex and a lighter staining central medulla. Okay, at the bottom, we have an illustration of one lobule, and you can see here's the cortex, here's the medulla. Okay, the cortex is where you have large numbers of T cells, those dendritic cells I mentioned a little bit ago, epithelial cells, and macrophages. Okay. Medulla is where you have more mature T cells, epithelial cells, dendritic cells, and macrophages. So what we have are lots and lots of T cells, okay? And these T cells come from our bone marrow, our myeloid tissue, where they're actually made, and they come into the thymus, which we learned earlier in this lecture is one of our primary lymphatic organs, where these T cells become immunocompetent. Think of these like soldiers that have just joined the military and are going to basic training. The site of basic training is within a thymus. And within your thymus, for the T cells, they become competent soldiers. They develop in the cortex. They then move as they become more mature to the medulla. And then once mature, you can see what they're going to do. They're going to jump into the bloodstream, just like a soldier is going to go off to war. Okay. Now, within the medulla, we have what are called thymic or hostile corpuscles. Dense concentric layers of epithelial cells. We're not sure exactly what they do, but they think that they might be the site of T cells, or T cell death, I should say, because not all T cells actually end up going into battle. And we can describe the thymus as a very important site of immunity in children. It's a reservoir for lymphocytes. We talked about it previously because of its role in secreting hormones like thymosin that help with T cell development. Immature T cells, as I mentioned, migrate here from the red bone marrow. Once in the thymus, they become concentrated in the cortex, develop. They then move to the medulla and then exit and enter the bloodstream, or even efferent lymphatic vessels, where they then can go to places like our lymph nodes and become functional, active, and immune responses. We can describe our thymus as a place where they develop, but they don't actually do anything as far as going into battle. Our thymus doesn't drain lymph, it doesn't drain blood, it doesn't have immunity responses taking place there, because it's the basic training site, not where the battle is taking place. In order for those T cells to properly develop, we have what's called a blood-thymus barrier that prevents any white blood cells from actually attacking those developing T cells. And then thymus, actually, as we mentioned previously, it shrinks as we get older to 3 grams in old age, whereas it's 70 grams in infants. So it's actually bigger. If you were to take an infant out and an old person's out, set them on a table, the infants will be bigger. As we get older, it becomes replaced by adipose and areolar connective tissues. Illustration, or picture, I should say, not illustration, shows you kind of the same thing I showed you with the lymph node, the caps on the outside with the projections inward. This would be one singular lobule, which is kind of cool to see. Not, something I wouldn't worry too much about studying though. Okay, our final organ I want to talk about is the spleen. It's our largest lymphatic organ. It's located directly below the diaphragm, which would be that muscle we've talked about before. It's in the left hypochondriac region, off to the side and a little bit behind your stomach. Okay? So it's kind of in our upper left abdomen area. Okay? Now, this organ has some organs that actually kind of push inward on it, and they not necessarily push it to the point where it indents, but there are indentations of the spleen that basically allow those other organs to kind of occupy a space. The upper surface, okay, which is why I like this picture, you can see is nice and rounded, okay, smooth and convex, and it conforms to the concave surface of our diaphragm, which I'm kind of mimicking here with my cursor. Neighboring organs, as I mentioned, make indentations on its visceral surface, which is what we're showing off in this illustration. There's a gastric impression, that's for the stomach. Anytime you see the word gastric, it's for stomach. There's a renal impression, that would be for, and that's what's right here, for your left kidney. And then the colic impression, which is shown right here, which would be an impression from the large intestine where it flexes, the left colic flexure. We'll see that here in a few lectures. And like our lymph nodes, there's a hilum associated with our spleen, which is where you can see these blood vessels are coming in, or in the case of the splenic vein, leaving. Okay. Like lymph nodes, there's a fibrous capsule on the outside, inward extensions called trabeculae that divide it into compartments. The functioning or parenchyma part of the spleen made up of 2 kinds of tissues, what we call white pulp and red pulp. And white pulp is where you find lymphatic tissue made mostly up of lymphocytes and macrophages. And this is where we filter, not lymph like lymph nodes, but instead we filter blood. Okay? And so we have blood coming into our spleen by way of a singular splenic artery. Before entering actually into the spleen, it divides, okay? And that forms eventually what we call central arteries, which you can see here is a central artery right at the center of our white pulp, okay? In fact, here we can see in our picture this central artery right in this almost smack dab middle of the white pulp in that picture on the right, okay? This is where B cells and T cells can carry out their immune functions like they did or do in our lymph nodes. The only difference, once again, we're filtering blood here instead of our lymph nodes, which filtered lymph. And we've also got macrophages that do their thing, performing phagocytosis. Okay. We also have within our spleen what we call red pulp. Okay. Red pulp consists of blood-filled venous sinuses, so it's kind of like almost like engorged blood vessels that allow blood to a little bit kind of pool inside. Not typically what we'd think of like pooling, like staying stagnant, but it almost does kind of stay stagnant a little bit. Okay? But within the splenic cords that we have in our red pulp, we have red blood cells, we got macrophages, we got lymphocytes, antibody producing plasma cells, and then we've got the 3 granulocytes, the basophils, eosinophils, neutrophils. Okay? What we do within the red pulp, we remove any defective blood cells. We talked about in our last lecture how red blood cells wear out over time. This is where they can be removed from our bloodstream. Same thing for platelets. This is done by those macrophages, those Pac-Man that will chew up and digest those things. We store up to 1/3 of our blood supply or body supply of our platelets within our spleen. And then during fetal life, we talked about this at the end of the last lecture, we perform hemopoiesis, the production of our blood cells, also known as hematopoiesis, but that's not where it takes place, after we develop our bone marrow later in fetal life. Okay, that's our lecture. I will stop it here.